Hello and welcome to our latest live. I'm coming to you from Inovi Fertility and Genetics Institute here in the center of Houston. I'm Dr. Stefan Krotz, and I have now 19 years of experience in the field of reproductive medicine. So today we're going to be talking about an interesting topic, which is egg donation. And of course, there's a lot of questions about egg donation, but we're basically going to be reviewing who should look for an egg donor and also how do you become an egg donor. So we're going to look at both sides of the story. So the first question is, who needs an egg donor? So patients that typically require egg donors are patients that have low ovarian reserve, or have had surgery to remove the ovaries, or have undergone multiple IVF cycles and not had a successful outcome, either due to few egg numbers or low egg quality. So when we talk about all these patients and we think about low ovarian reserve, what does low ovarian reserve really mean? So low ovarian reserve means a low number of eggs. And basically after a certain point that can mean no eggs or entering menopause. So probably the easiest way to think about this is to talk a little bit about menopause and what that means and how it applies to low ovarian reserve. So women are born with 1 to 2 million eggs, and by the time they're 14 to 15 years old, they have around 400,000. And so every month when they ovulate, 1 egg is released and 1,000 eggs go away. And a woman is going to have about 400 ovulatory cycles throughout the course of their life. And then after those 400 cycles where they ovulate, once they hit a point of having less than 1,000 eggs, then that's the point where they undergo menopause. And the average age of menopause for most women is 50 to 51 years of age. Now, sometimes women worry about early menopause, but it's only really considered early if your menopause is before the age of 40. And things that can cause early menopause, it can be genetic, for example. So that means that you have a genetic condition or you're born with a genetic mutation that causes early menopause. And this is an area of focus and research in the field of infertility and still a developing area. Some women may have something called FMR1, which is fragile X, and that means that there is a certain area on the X chromosome that can cause women to develop early menopause, and it can be transmitted from mother to daughter and continue to get worse through generations. And then, of course, anybody that's had chemotherapy or radiation therapy is at risk for having a low egg count. Or anyone that had surgery to have their ovaries removed, obviously then they will have a low egg count or 0 egg count. So when we're testing for ovarian reserve, we want to see if women, if their egg count is what's expected for their age, or if it's lower than normal. So what are the ways that we can check your ovarian reserve? The number one way is with an anti-Mullerian hormone test, which is a blood test. And this blood test can be done at any time during a woman's menstrual cycle. And this is a hormone that's released by the cells that surround the egg. So the expectation is women that have an anti-Mullerian hormone of 2 at the age of 35, that's normal. And then at the age of 41, a level of 1 is normal. And what happens, or why we like this AMH level, is because throughout a woman's life, the AMH level continues to go down and kind of approximates the decrease in eggs that I talked about at the beginning of the live session. And so with time, this level goes down until it eventually reaches a point where it can't be measured anymore. And that level is typically around 0.015. When a woman's AMH level is low, around 0.2 or less, then we should typically go ahead and check something called an FSH level. And the FSH level, FSH stands for follicle stimulating hormone. And that's the hormone level that starts to go up as a woman starts to approach menopause. So throughout most of her life, the FSH level is going to be between 2 and 10. And then once a woman starts to approach menopause, then that level will start to go up. Now, I told you the average age of menopause is 50 to 51, but women start to experience changes in their FSH levels typically around the age of 45. So around the age of 45, that number will start to go up. And if the FSH level is above 15, then that suggests that they may not do very well with fertility treatments using their own eggs. And a level above 25, especially if it's measured 6 weeks apart or longer, then suggests that they're at a menopausal level. Even if they're still having regular menstrual cycles, their chances for succeeding with their own eggs is low. And finally, there is the ultrasound. The ultrasound is a way that we can look at the ovaries and check what the antral follicle count is. And the antral follicles are the follicles that are on the ovary, which are little fluid-filled cavities where the eggs are developing. So if a woman has anywhere from 0 to 2 antral follicles on her ovaries, that's also suggestive of a low ovarian reserve or low egg count. However, we typically tend to favor AMH and FSH when making these decisions. So let's say you go to see the fertility doctor because you're having problems getting pregnant and your AMH level is low and your FSH level is above 15. That's typically when we would recommend using donor egg. Also, even if a patient's values are still normal, typically above the age of 46, it's going to be extremely difficult to get pregnant with your own eggs. And the truth is, after 44, it's already pretty difficult as well. So if you fall into one of those two categories, either by age or by having an elevated FSH level, then we typically recommend using donor eggs. And why is that? Because if you have extremely low AMH or an elevated FSH, or you're above the age of 46, then your chances of getting pregnant with your own eggs using IVF or with insemination is going to be less than 1%. And then if we use an egg donor, the egg donor will typically have a success rate per transfer of around 50 to 60%. So the chances get to be much higher. And of course, then, if the main goal is to get pregnant and conceive and start a family, then using an egg donor is going to be much better. Now, we understand, of course, that using an egg donor, deciding to use an egg donor can be a difficult decision. And for many people, it may take months, even years, to arrive at that decision. So we know that it's not a decision to be taken lightly. But I tell patients that, one of the hardest parts about using an egg donor is coming to the realization that's the best path to take. And then when they're able to conceive and have a normal pregnancy, and then they're holding the baby in 9 months, then they're always happy that they went through the process, and the rest of it is kind of in the rear view mirror. So let's say you go to the fertility doctor and you find out that you should use an egg donor. The next question is, so how does that process work? Well, there are typically 2 ways to get eggs from an egg donor. And the first one is actually becoming very common, and that means getting eggs from an egg bank. So what is an egg bank? An egg bank is an organization that basically coordinates the distribution of eggs that are retrieved from egg donors. So what does that mean? That means that an egg donor has gone to a fertility clinic, and a lot of times it can be anywhere in the country, and they've had their eggs retrieved, and then those eggs are sent off to the egg bank, or they're stored at the fertility clinic where they were retrieved. And then once somebody decides that they want to use that egg donor, then the eggs are sent to the fertility clinic where the patient would like to receive their treatment. So how do patients decide on which egg donor they want to use? Well, once those patients are recruited by the company to be an egg donor, they have a profile that is put on the internet. And that profile is under the website of that specific company. And so what's in the profile? The profiles often include information such as hair color, eye color, has a picture of the egg donor. It also has a questionnaire that asks them about their likes, dislikes, what their aptitudes are, what their background is, and often what their educational status is. So this gives the potential parents, or what we call intended parents, an idea about the egg donor. They also have background information about the egg donor's family history and their personal history, psychologic history, and then there's genetic testing done. And the genetic testing is called a carrier screen. And the carrier screen is very important because if a patient is going to use an egg donor, then we want their male partner to be compatible with the egg donor. And when we mean compatible, we mean that they're not carriers for the same genetic condition. So when we talk about the genetic conditions we're looking at, we're talking about things like cystic fibrosis, Tay-Sachs, sickle cell anemia, alpha thalassemia, spinal muscular atrophy, and a whole list of others. The carrier screening panels that we use, and now that are most common, are panels that have approximately the 280 most common genetic disorders. So all of that information is listed in the donor's profile. And the way that you can go on to the website and figure out which donor you want to use is by going onto the internet, and you go onto one of the websites. Probably the largest one in the country is Donor Egg Bank USA. And so you go on to Donor Egg Bank USA website, and then you just create an account, and then they let you look at all the profiles online. You can decide which of the donors that you like to use, and then once you do that, you should discuss this with your physician first before ordering the eggs from that specific donor, so that the physician or the nursing staff at that practice can make sure that that donor is suitable for you. And you can pick whichever donor you like based on whatever criteria you're using, just as long as it's a good fit in terms of the carrier screen and there are no other medical conditions in the patient or the family history that is cause for concern. So often when I look at the profiles of potential egg donors for patients, I'm also looking for a pattern of genetic disorders or other disorders that seem to be very prevalent in the family, because that can suggest that there's a genetic disorder that may not be mentioned in the carrier screen. So you can go on to any of these sites, like I mentioned, Donor Egg Bank, Fairfax, or there are also a host of other smaller sites, and then you can decide on which egg donor that you want to use. You discuss it with your physician, you show them the profile, and then what happens is that you can go online and literally purchase the eggs, and they will be sent to the practice where your physician is at. Typically, they send somewhere around 6 to 8 mature eggs to the facility where you're planning to do your fertility treatment. And at that time, once the eggs are shipped over, the eggs will be injected with either your partner's sperm or donor sperm, depending on your particular situation. Once those eggs are injected with the sperm, they take about 5 to 6 days to develop into what we call a blastocyst. And then depending on what you've decided with your team at the fertility clinic, then they can determine, well, are we going to go ahead and transfer those embryos right away, or will we go ahead and transfer the embryos at a later date? Typically, a fresh transfer is considered better than a frozen transfer, but the technology now with the frozen transfer and thawing is so good that the difference really is very small. The other reason that patients may want to have a frozen embryo transfer is if they want to do genetic testing on the eggs from a donor egg bank. But this is not always necessary, required, or even suggested, because a lot of times the eggs from a donor egg bank are from patients, or they're always, I should say, from a patient that's under the age of 30, and so therefore they have a high chance of being genetically normal, at least chromosomally normal. So when we talked about there are 2 different ways to do or use some eggs from a donor, the donor egg bank one is one of the most common and most widely used. And the second way would be to use eggs from a donor agency. Now, how does it work when you go to a donor agency? Well, when you go to a donor agency, they also have profiles from patients that are willing to serve as a donor. And the advantage of using eggs from a donor agency is that typically you can get twice as many eggs from a patient when it's through an agency, although typically the cost can be higher. So that's nice because you can usually end up with twice as many embryos using a donor from a donor agency than if you use a donor from an egg bank. The donor agency, one of the things that makes it different though is that whenever you're planning to use eggs from a donor agency, then you will be required to set up a legal contract with the egg donor. And then also sometimes it can take a little bit longer for the process because the additional thing that will be required is that the egg donor will have to undergo testing at the fertility center where you will want to have the procedure performed. And then also you have to wait for the availability of the donor. So the advantages, of course, of using an egg bank is the eggs can be ordered and be received by the facility within 2 weeks. There are no legal contracts with the egg donor. The advantages of using a fresh donor from an agency, of course, would be that you get twice as many eggs and potentially up to twice as many embryos as you would from using an egg bank. So both of them have their advantages, and both of them are just based on your preference and also what you find using the egg bank. So sometimes we have patients that look at the egg banks and don't find anybody that they would prefer to use, and so they go and we put them in contact either with a local donor agency, or they present us with a donor agency located elsewhere, and the eggs can be sent to our practice for use. Also, with the donor agency, when they send the donors to us for evaluation, we're going to go ahead and check their AMH levels, and we're going to check an ultrasound to make sure that they're a good fit for you. So we want to make sure that they have good ovarian reserve and that they're able to get at least 10 to 15 eggs so that you have a good result. Please keep in mind that no matter which of these ways you do it, the egg donor is going to be anonymous, so you will not know their basic information. One of the other way to find a donor, of course, is to use somebody that you know. And so a lot of times patients think initially, they're like, well, I want to have so-and-so be my egg donor. It could be a sister, could be a cousin, it could be a friend, which of course is a totally natural response. And you think, well, this is a great idea. However, one of the issues becomes later on at social gatherings or later on at some point in the life of the child is questions of, you know, who is the parent of the child, who is the biological parent, and you know, who raised the child. And then of course the other consideration is, you know, disclosure. So when will this information be disclosed? And also, you know, how will the person who was the egg donor be able to manage the situation later on? So it can often make it easier to use an anonymous donor because it doesn't affect any of your social interactions then with family members or friends that may be involved or that may have been involved in the process. Also, one of the other things that we do is we have all patients that undergo third-party reproduction, meaning using donor sperm, using donor eggs, or using a gestational carrier, we have them all talk with a reproductive psychologist. And the reproductive psychologist will talk to them to let them know about what the expectations are, when is it best to disclose to the child that they were conceived with a donor egg or donor sperm, and really gives patients and intended parents a big overview of what the process looks like. So finally, we get to the last question, you know, how do I become an egg donor myself? Well, there are a couple of ways, but typically it involves either contacting a donor agency to ask them if you can become an egg donor, or going to a fertility clinic. So either of those ways, you will set up an appointment and there will be an interview where they will go over the egg donation process with you, And then also you will be required to fill out forms, and that those forms will have information about your educational history and your medical history and your family medical history and genetic testing that's required. So a lot of the same things that you would expect to see when you are a patient looking on a profile online for the donor. So a lot of times people also want to know about compensation for egg donors, and that's something that can be discussed by the agency or the egg bank in which you are interested in becoming a donor with. And also one thing that you should remember too is, as we discussed before, there are agreements that are signed between either the intended parents, if you're using an agency, and the egg donor, or if you're using an egg bank, between the egg bank and the potential egg donor, so that once the person who donates the eggs is finished with the process, then they do not have any further rights to the child or any legal rights to the child. And so that makes it for a much more clean process for the intended parents, and then there's never any questions about parentage for the child and who's responsible for the child. So I think overall, egg donation is a wonderful thing. It's allowed a lot of patients and parents or intended parents to become parents, and it has really created a lot of good in our field, and has also extended a lot of the longevity or ability of people to become parents in the first place. A lot of times people are involved with their careers, jobs, and other situations in their life where they had to put off childbearing, or something happened where they needed surgery and no longer have ovaries, or any other set of circumstances, and they want to become parents. And the great thing is that this gives them the opportunity and extends the opportunity for them to become parents by anywhere from 5 to 10 years. So I want to thank all of you for your attention today. If you have more questions about egg donation or becoming an egg donor, please don't hesitate to reach out to us. We're happy to help you. You can get a hold of us here at inovifertility.com. And I wish you all a wonderful evening, and we'll be seeing you soon. Thank you.